What up? Hey guys, it's Dr. Bunches, or Dr. Bunch. How are you guys doing today? Natalia told us to make a video to kind of give you guys a little look into our lives as emergency medicine residents, kind of show you a little bit about what our day looks like. It's kind of hard right now since I'm not in the emergency department. I'm at home, but I think the best thing to do would be to tell you what I do before I go to work, and how I prepare before my day. And then I think later on, I can maybe make another video and show you guys kind of what it's like in the department and kind of what that looks like. So first things first, I usually make sure I get enough sleep before my shift. If it's an overnight shift, which I love, I try to get at least 7 hours of sleep. If it's not an overnight shift, I try to get at least 6. Now, you guys should be getting way more sleep than that. But it's just the nature of the job that we do and training. And so right now, that's kind of the amount of sleep I'm getting. My off days, I try to get more, but I want to make sure I'm well rested because our shifts are high intensity. We don't really sit, we don't take breaks, we barely go to the bathroom. So we need to be on for those 8 to 10 hours that we're working. So after I get up, I shower, I get a nice new clean set of scrubs, and then I pack my bag. So what do I put in my bag? So first things first, I make sure that I have this, my stethoscope. This is important. This is pretty much our number one work tool here, apart from this up here. I have forgotten this before. My first day as a doctor, I forgot my stethoscope. I had to turn my car around and drive all the way back home to get it. I was so nervous. But now, I usually remember it every day. The next thing is I like to make sure I have my ID badge, which is very important. My ID badge identifies who I am to my patients, to other hospital staff. It also gets me into doors and the storage closets and stuff where I can get supplies to do things. The other thing I make sure is that my badge has my Black Lives Matter pin, because Black lives and brown lives do matter. Next, I'll make sure I have my light pin. I can look into your soul. So that I can check people's eyes, see the back of their throat, that kind of stuff. Other thing I make sure I have is my pin. I carry one pin. This is my pin. I don't let anybody else use this pin because I'm very particular about my brand of pins that I get. And next, trauma shears. So these are pretty sharp scissors. Anytime somebody comes in for a trauma, meaning a car accident, stab, gunshot wound, falls, we have to make sure that we assess their entire body for any signs of injury. One way that we do that is when a patient comes in, we cut off all of their clothes, which is why I always tell people, make sure you wear good underwear and good socks and make sure it's clean. But these are pretty sharp, so they can cut through jeans, they can cut through leather jackets. So I make sure I always have this. I make sure that I always clean it after my shift and before my shift. And then next, my brown coat. I make sure that I have my lab coat with me. It's very important. Again, it also helps identify you. It also helps keep you a little bit clean. And in the wintertime, it helps keep me warm. Not everybody wears their lab coat or their brown coat. I'm one of the few that still does because I feel a sense of pride in my program and who I am as a doctor. Also too though, not everybody believes me that I'm a doctor. I know, right? Crazy. So part of wearing a lab coat also identifies me as a physician. And it kind of makes me a little bit more believable, which shouldn't be something that we have to do nowadays, but unfortunately, it's kind of the world we live in. And I demand respect. Now, It just helps ease other people's minds to understand and be able to determine who's the doctor in the room and who's the nurse or anybody else. And then lastly, I always make sure I have this, my lip chap, because you gotta talk to people all day, your lips get chapped, and you wanna keep them moisturized. So after I get my backpack, I make sure I have enough snacks, I make sure I have water, and then I head into work. So that's about my pre-work routine. I always make sure I have a good playlist, usually something that really just gets me going, like gangster rap or something like that. And then I just peruse on into my shift. Our shifts are usually about 8 to 10 hours, depending on where we are. And you could see anywhere from 8 patients to, I've seen as many as 32 patients in a shift. It all depends. Everybody's different. Everybody comes in with a different story. And I think that's what's the really cool part about emergency medicine is I get to meet a very diverse group of people every day that I work, which is very unique. So I'll leave you with that. I appreciate you guys for everything that you're doing. I know it's tough right now. I know that there's a lot of uncertainty, but staying away from people, washing your hands, making sure things are clean, taking care of your family. These are all important things. Keep your head up, keep learning as much as you can during this time, and do what you can to, center yourself and be well. We're gonna get through this. It's gonna be hard, but we'll get through this, and I can't wait to see you guys afterwards when we can hang out. You guys take care, and I'll see you later. Peace.